Dr. Guleria. I feel like we're back. We've done 2 years of shows like this every Saturday night, and unfortunately here we are back asking you this question: do we now need to worry? You have the biggest ongoing COVID-19 wave in this, now these COVID cases coming out of China, now speculations about a wave in India, high-level meetings at the national level, state level, mock drills, some advisories based on speculation, one school shut down for a while. I'm sure you can understand this has created a bit of panic, apprehension among citizens of India. So please, can you clarify for us your thoughts on this? Should one be worried? What does one need to do?
So my thoughts on this are that one needs to be vigilant, but I don't think there's a need to panic. As we see every year during the change of weather, and this time the weather has been a little bit peculiar in terms of the fact that it's rained a lot, even the last 2-3 days. There is going to be a surge of what we call respiratory viral infections. We saw a surge of influenza H3N2, and now we're also seeing a surge in COVID cases. As long as we don't see a surge in the number of admissions or a huge increase in the number of deaths, I don't think there is a cause of concern, but we need to really be vigilant, because there's always a concern that the variant may become more virulent. Currently, for the last, I would say, more than a year since Omicron came in, all its sublineages or the variants that have come have actually caused predominantly a mild infection. And we've seen a number of variants of Omicron coming in, and now the XBB also. But by and large, they've all caused a mild infection, fever, cough, sore throat. The infection hasn't gone down into the lungs as we saw during the Delta wave, causing this acute fall in saturation, oxygen need. However, the high-risk group, the elderly and those with comorbidities, need to be extra careful, because they are the ones in whom there can be a hospitalization and death.